So let's talk a little bit more about learning from mistakes. I think this is a key part of a lean culture. This is an important part of the Toyota culture, is demonstrated by a number of guests on a podcast that I started in September 2020 called My Favorite Mistake. A couple of former Toyota leaders have shared stories, one from Japan in the 1960s, another story from Kentucky in the 1980s, about a very similar mistake that they were a part of, a systemic error, and instead of blaming and punishing these two individuals, the leaders, again, Japan, Kentucky, separated by halfway around the world, a couple decades apart, the consistent culture not only refused to punish them because the mistake wasn't their fault, it would have been unjust to punish them, it's also counterproductive. The more constructive thing to do is to work with them and make sure we're learning from a particular mistake so that we can focus on improving our processes and systems so that we do not repeat that same mistake. So some of those stories and from others are included in my book, The Mistakes That Make Us. When I ask people, what's your favorite mistake? Story inspired his career as being a patient safety advocate, that he is improving the lives of far more patients in that role than he would protecting the patients who are directly in front of him in the operating room. So I appreciate his willingness to learn from that story and to share it in a way that hopefully inspires others to work toward this culture change. And because, again, all of us, including the best surgeons, we all make mistakes, large and small, and that's the focus, one of the focus points in the theme of the book. We all make mistakes. What's optional, but clearly preferable, is that we learn from our mistakes. We all make mistakes, not everybody learns from them. Not every organization really makes it safe and possible for people to learn from their mistakes. So the structure of my book, I try to be a little prescriptive with the chapter titles. Chapter 1, Think Positively. How do we turn a mistake into something positive? How do we focus on learning and improvement in the prevention of repeated mistakes? That's a function of culture and individual practice in a way. Chapter 2, Admit Mistakes. But again, we need to make sure that it's safe for people to do so. Chapter 3, Be Kind. Be kind to yourself and to others when mistakes occur. And I use the word kind very intentionally. I would make the case, and the book does so, that we shouldn't be punitive, but we also shouldn't just be nice, where I think a nice reaction to mistakes is comforting. When people use language like, it's okay, I know you didn't mean to do it, it's not your fault, that doesn't help prevent future errors. Being kind is more constructive and action-oriented, where we use the methods I talk about in Chapter 4 around how to prevent mistakes in a systemic way. Chapter 5, Help everyone to speak up. This again comes back to psychological safety. Chapter 6, Choose improvement, not punishment. So we try to prevent mistakes, but we realize when they do occur, we need to react to them in a way that's kind and constructive instead of punitive. Chapter 7, Iterate your way to success. This is basically that iterative PDSA model again. And then Chapter 8, Cultivate forever. That culture in an organization is like a garden. You don't install a culture, you don't implement a culture. It's really something that you have to continuously nurture over time, the way you would plants. Again, learning from mistakes is a core part of the Toyota mindset and philosophy. Their internal document from the company called the Toyota Way 2001 says in part, we view errors as opportunities for learning. And as individuals or as a team, I think one way we can learn from these mistakes is to think through a set of questions. When we've made a mistake, when a mistake has occurred, a wrong decision, a wrong action, and we only know that it's wrong, after we've made the initial decision. A mistake is something that seems right in the moment, but then as we learn more, or as time passes, we recognize maybe there was a bad assumption, bad information, something that led to a decision that later turns out to not be correct. So we can think through, what decision did I make? What did I expect to happen? What actually happened? So if there's a gap between what we expected to happen and what actually happened, we can ask, we might also ask, why was there that gap? But the core question around that is, what do I learn from that gap? What would I do differently in the future, including how might we prevent that mistake? What would I expect to happen? So even in the case of that wrong side surgery, the decision was to make an incision on, I think it was the right side. What the resident surgeon expected to happen was to find the hernia, that was the correct side. What actually happened was they learned it was the wrong side. And I think a lot of organizations then miss this opportunity to learn from the gap. What would I do differently? This leads to practices like surgical timeouts, marking surgical sites, making sure that people are not rushed for time. What would I expect to happen through a change in practices, a reduction, if not an elimination, of the mistake called wrong side or wrong site surgeries? Not all mistakes are the same. There are some mistakes that we should absolutely work really hard to prevent. These would include surgical errors, medication errors, things that mistakes that we can prevent when we follow known procedures and when we're able to do so. And then there are other mistakes that we might describe as failed attempts to improve the patient experience. So when there's I think two broad categories. One are kind of routine work and mistakes that in theory we know how to prevent, so let's turn that theory into practice. And then there are things that are more a matter of improvement and innovation. We had a hypothesis. We thought making a certain change would lead to higher patient experience scores. That could turn out to be untrue. And we can go back through those same questions and think about our mistake instead of refusing to admit the mistake, instead of blaming or punishing people for the mistake. We need to make sure that we learn. Part of that learning involves using small mistakes to prevent big ones. A friend of mine who I work with, and he was interviewed in the podcast, and this story is in the book. He's an emergency medicine physician, and he talked about what's sometimes the lost opportunity to learn from a small mistake. So, for example, let's say an order had been written to give 600 milligrams of ibuprofen to a patient, and the nurse, is coming up about to give the medicine, and maybe it's what some would call a good catch. The nurse discovers it at the last minute by double checking the medication or scanning a barcode. Oh, I'm holding 800 milligrams. I almost gave the wrong dose to the patient. At a lot of organizations, that's the end of the story. The nurse goes and gets the correct dosage, administers it. That's the end of the story. And that creates a situation where there's a lost opportunity. Like, even though there wasn't really a mistake that reached the patient, even though there wasn't harm, and even if the wrong ibuprofen dose had been given, probably not harmful, if we took advantage of the opportunity to learn, why did we have a near miss medication error? We need to learn from that, improve our processes in ways that would prevent the same process problem in the future from creating a different form of this mistake that could be harmful or deadly, right? So instead of kind of throwing that opportunity for improvement away, we need to make sure, again, for one, that people feel safe, saying there's a mistake has been made, that we've had a near miss, or we've just identified a risk. If people don't feel safe to point that out, we can't solve a problem that we don't know about. So that's why psychological safety is such an important core to the lean approach and to the Toyota production system. When we can react constructively to mistakes, and again, I think there's kind of a progression. Punitive is counterproductive and unjust. A nice reaction might be unhelpful in terms of reducing future mistakes. Being kind, which means being more constructive, action-oriented, again, around preventing future mistakes. I think that's the best approach. It's not good that a mistake happened, but we can turn it into something positive. That's the thinking positively part of the book. And again, recognizing that culture is something that we have to constantly cultivate. It's not enough to plant seeds or to plant a seedling. This idea, I think, applies to our lean culture efforts. This is something we have to continually cultivate and nurture. It applies to a culture of continuous improvement. And as a subset of that, how do we get a culture of continuous improvement? A key piece is cultivating a culture of learning from mistakes. So again, I would invite you to reach out if you have questions. My email address is mark@markgraban.com. I would invite you to check out the podcast. That is, of course, free, as most podcasts are. My Favorite Mistake podcast. It's available internationally. My most recent book, again, The Mistakes That Make Us, mistakesbook.com, should be available through Amazon worldwide and hopefully through other retailers. If you're having trouble finding the book, you can email me about that. And then my previous books are shown here. My first book, Lean Hospitals, again, has been translated into many languages. Healthcare Kaizen, that I co-authored with Joe Schwartz, is about this culture and practice of continuous improvement. And then a previous book of mine, Measures of Success, is about basically the application of statistical methods to performance measures that we could apply to charts around safety, quality, delivery, cost, and morale. So again, thank you for the invitation. It's an honor to be asked to speak to you. I hope what I shared today has been both interesting and helpful to you in your future improvement work.